All right, we are looking at a cross-section of the spinal cord. The one down here is a little bit more simple, doesn't have the spinal nerve roots and the spinal nerves coming off of it. So we'll take a look at that first, and then we'll move up here to see some additional structures. So when you're looking at the spinal cord, you'll notice that the gray matter is in the center, although it's not colored gray here. And the white matter is on the outside of the spinal cord. So the gray matter tends to look like a butterfly, and so you want to focus on the wings here because they're going to help you to understand which side is posterior or dorsal versus the other side, which is anterior or ventral. So the key is to look for the area where the butterfly wings almost touch the very outside edge of the spinal cord. So that would be up here, and so this is the posterior or dorsal side. So the butterfly wings tend to touch or nearly touch the edge of the spinal cord on the posterior side. So this is posterior up here. Down here will be anterior or ventral. Notice that the wings of the butterflies don't come anywhere near touching the edge of the spinal cord on the anterior surface. Okay, once you have that down, then you can name the horn areas of the gray matter. So up here, where you're on the posterior side, this would be called the posterior horn of the gray matter. Over here, where you're on the anterior side, this would be called the anterior or ventral horn of the gray matter. And coming off to the side, that is the lateral horn area. There is a connection between the two butterfly wings, or the two sides of the gray matter, and that is called the gray commissure. And in the very center, you have a hole where cerebrospinal fluid will move through, and that is called the central canal. Okay, so now we are going to move to the white matter, which surrounds the gray matter in the spinal cord. And notice that there are separations between the right and left sides on both the posterior area of the spinal cord and the anterior area of the spinal cord. On the anterior side, that split between the right and left sides, that is called the anterior median fissure. And on the posterior side, this is called the posterior median sulcus. A lot of people will be confused about which one is the fissure and which one is the sulcus. Just remember that on the posterior side, you should remember PMS. Posterior median sulcus. That way you'll remember that's the sulcus, the other one is the fissure. You can't really forget PMS. There are connections which are not very visible on this model, and it would be very close to the gray matter, but the white matter does connect a little bit right and left sides. That would be the white commissure area. You also have columns, which are also called funiculi, of white matter in the different areas. So if you're on the posterior side, this section of white matter is called the posterior column or the posterior funiculus. If you're on the anterior side, this area of white matter is going to be called the anterior column or the anterior funiculus. And if you're off in the lateral areas, this is called the lateral column or the lateral funiculus. We just need to move up to the upper structure here so we can see the spinal roots coming off of the spinal cord to form the spinal nerves. And there is this enlargement on the dorsal or posterior side, and that is called the dorsal root ganglion. So it seems to like bubble up a little bit, and that's on the dorsal side.